Before January 1st, 2026, whenever you want to code lower extremity revascularization procedures, we have only 3 territories. But currently, what I mean, from January 1st, 2026, we need to use 4 territories. Even when we have 3 territories, it is very difficult to code these revascularization procedures. Now we have 4 territories. So in this scenario, in order to code revascularization procedures, we need to understand anatomy as well as the CPT codes as well as the example scenarios related to these LER procedures. So in today's session, we will learn anatomy related to lower extremity arteries as well as the new CPT codes as well as few example scenarios related to lower extremity revascularization procedures. If you are visiting for the first time, please click on like button in order to provide motivation to me to create more educational videos. And also if you are visiting for the first time, please click on like button and also click on subscribe button. So today's our topic is 2026 lower extremity IVR coding with examples. So before going to practical, we need to understand few theory related to vascular family as well as vascular territory. So what is a vascular family? Group of vessels that arise from a primary branch. So indirectly, network of vessels that arise from the aorta or vena cava. And also network of vessels that arise from the access site. So if you know IVR coding, from the aorta we have 3 vascular families. Next we need to understand vascular territory. So vascular territory refers to the organ or anatomical region supplied by a particular artery. So in today's session, mostly we are going to see about vascular territories. Like as we have discussed previously, we have 4 vascular territories in lower extremity revascularization procedures. So as we have discussed, in the lower extremity, we have 4 vascular territories. First one is iliac vascular territory, femoral popliteal vascular territory, tibial peroneal vascular territory as well as inframalleolar vascular territory. First we will see anatomy related to these iliac vascular territory. In iliac vascular territory we have 3 arteries: common iliac, internal iliac and external iliac. So these are the common iliac, internal iliac and external iliac. So these are the 3 vessels we have in the iliac vascular territory. Next we have femoral popliteal vascular territory. So here we have 2 vessels: common femoral, profunda femoris, superficial femoral and popliteal. So basically you might be confused. Why 2 vessels? So basically here we have combination of the vessels. Okay. So common femoral and profunda femoris treated as a single vessel. So where is the common femoral and profunda femoris? So this is the common femoral and this is the profunda femoris. These 2 considered as one vessel. So that's why I told 2 vessels. Okay. So next we have superficial femoral and popliteal treated as single vessel. Okay. Superficial femoral as well as popliteal. This is the popliteal. These 2 are considered as single vessel. So basically here we have total 4 vessels. Okay. But for coding purpose we need to use only 2 sets. First one is common femoral plus profunda femoris. Next one is superficial femoral plus popliteal. Next we have tibial peroneal vascular territory. Okay. So here we have anterior tibial, posterior tibial, peroneal. So this is the tibial peroneal vascular territory. Anterior tibial, posterior tibial, peroneal. These are the 3 vessels. So here also tibial peroneal trunk is not reported as separate vessel unless it is the only vessel treated. Okay. So if the patient performs only tibio-peroneal trunk procedure only, you need to code this code. So otherwise this is included in the peroneal artery. Next we have inframalleolar territory. So dorsalis pedis and plantar. So here is the image. So dorsalis pedis as well as plantar, medial plantar and lateral plantar. These are the vessels in these 4 vascular territories. Now we will see codes related to iliac territory. So in iliac territory we have 3, 7, 2, 5, 4. Okay. So this is for angioplasty, unilateral straight forward lesion initial vessel. Okay, 37255. So here we have plus symbol means it is a add-on code. So we need to use this code along with the primary procedure, means along with 37254. So here you might have the confusion of what is straight forward. So basically straight forward means stenosis or less than 100% obstruction is called as straight forward lesion. Okay. In the operative report, in order to identify straight forward, you need to check whether which is stenosis or occlusion. So for stenosis, we will use straight forward lesion. For occlusion, we will use complex lesion, which we will see soon. And if it is 100% obstruction, we will need to code it as complex lesion. Okay, next we have 37256. So unilateral complex lesion, initial vessel 37257, each additional vessel. So I told you correct. So straight forward lesion is less than 100% obstruction. So complex lesion means 100% obstruction where contrast will not cross the lesion. So that time you will need to consider it as complex lesion. Okay. So these two codes are related to angioplasty. So 37254, 37255, 37256 and 37257. These all are related to angioplasty. Okay. So next we have combination code 37258. Okay. So here patient will perform stent placement and angioplasty. So this is the more severe than angioplasty. Okay. So where patient will perform stent placement, whenever patient performs stent placement, we no need to code angioplasty separately. Okay. Here also straight forward lesion. So 37258 straight forward lesion, 37259 straight forward lesion, each additional vessel in the same vascular family. Okay. So 37260 here also angioplasty along with stent placement unilateral within the same artery. Okay. So this is complex lesion. Okay. So 37261 is for complex lesion, each additional vessel. So as we have discussed, stenosis means you need to consider it as straight forward lesion. If it is occlusion, we need to use it as, or you need to take it as complex lesion. Okay. So that is the guideline. So like that 37260 and 37261. 37260 stent placement and angioplasty. 37261 add-on code. Okay. So this is for complex lesion. Means here in the operative report, you need to check what is the percentage of the occlusion. Okay. If it is 100%, you can consider it as complex lesion. If it is less than 100%, you need to consider it as straight forward lesion. Next, we have 37262. So this is also a add-on code. Intravascular lithotripsy, iliac vascular territory, including all imaging gadgets and regular supervision interpretation necessary to perform the intravascular lithotripsy within the same artery. So, as it is a add-on code, you need to use this code along with the primary procedure. So what are included in lower extremity revascularization CPC code? So access and selective catheterization is included, crossing the lesion is included, radiological SIND is also related to, intervention is included, embolic protection included, closure of arteriotomy included, imaging to document completion included, and these are also through the same access site performed on the treated vessel. So if you see here, so straight forward is equal stenosis, complex is equal occlusion. The documentation contains stenosis are less than 100% stenosis. You need to call straight forward. The documentation contains occlusion or 100% obstruction. You need to code it as complex lesion. So you can use lithotripsy code 37262, maybe reported 3 times per leg, as we have 3 arteries. Okay. So discrete lesion treated in separate territories may be separately reported with the appropriate primary code. If the patient performs these 2 procedures in 2 territories, you need to code them using primary code related to each and every territory. Next, we will see guidelines related to iliac vascular territory. So as we have discussed, we have common iliac, internal iliac, and external iliac. So use only 37254, 256, 258, 260 for initial artery treated. So now we'll see guidelines related to iliac vascular therapy, which contains common iliac, internal iliac, and external iliac. So if you want to see the images, so you can see the image. This one, the common iliac, internal iliac, external iliac. Okay, so use only 37254, 37256, 37258, 37260 for initially treated or initial artery treated. So basically, these are primary course. Okay, so angioplasty, stent, as well as lithotripsy or intravascular lithotripsy. If you see here 37254, angioplasty only, straight forward lesion. Okay, so 37256, angioplasty, complex lesion. Okay, so 37258, stent placement and angioplasty, primary or straight forward lesion. Okay, so next one is we have 37260. So this is for complex lesion, stent plus angioplasty. Okay, so 37261, 37262 are the add-on code, and 37260 is for intravascular lithotripsy or neovascular territory. So we'll see guidelines. One primary code is used for each territory treated. So if anyone looking for medical coding jobs in UAE, USA and India, please join in WhatsApp group. Group link is in the description of this video. So, and also will provide trainings related to same-day surgery, IPDRG, SCC, as well as CCS certification. If anyone looking for these certifications as well as training, please send WhatsApp message to 707-526-3939. So one primary code is used for each territory treated. Okay, so based on the territory, we need to code here. We need, if the patient performs same procedure in different territories, we need to code two primary codes. So additional vessels may be built with the appropriate add-on code. So as we have discussed, if the patient performs same procedure in the additional vascular territory in the same FAM, so we need to use add-on code. So a maximum of two add-on codes may be used for like in the iliac territory. Okay, so maximum as in the iliac territory we have three arteries. Whenever you want to code add-on code, maximum you can use two add-on codes. Report stent code when more than one stent is placed in the same vessel. If the patient performs multiple stents also in the same vessel, you need to use only one code. Okay. So lesions crossing territories treated with a single therapy should be reported with one code. So for example, from iliac territory to femoral territory, if the patient performs only angioplasty, that time you need to use only one code, which is more distal. Like in this scenario, you can code femoral territory angioplasty code. Okay. So interventions on each leg are reported separately. Use modifier 59 to generate separate distinct procedures. So we can code as we have separate codes for each territory. We need to code each leg. Okay. Next, interventions are reported per vessel, not per lesion. So this is very important. We need to code these codes based on each vessel. For example, if you take iliac vascular territory, we have three vessels. Okay, common iliac, internal iliac, as well as external iliac. So these are the three vessels. So based on that, we need to code based on vessels, not for the lesion. Code to the most extensive service performed. For example, if the patient performs in one vessel, angioplasty only, in another vessel, angioplasty with stent placement. Okay, so we need to code angioplasty with stent placement. So along with this procedure, if the patient performs atherectomy, so we need to use this 0238. This is a add-on code. Okay. So procedure that does not. So next guideline, procedure that does not cross the lesion should be built with the appropriate diagnostic angiographic code. Okay. For example, patient is perform angioplasty, but the catheter does not cross the lesion. So that time we need to code diagnostic angiography as well as catheterization. For bilateral procedure, we need to use 50 base code or 50 modifier. In next video, we will see remaining vascular territories. So thanks for watching this video. So if anyone looking for surgery, IPDRG, SCC, CCA trainings, please contact 707-526-3939.